Hi, today we will talk about artificial intelligence in detecting of colonic polyps using Fujifilm Endoscope and the CAD eye by Fujifilm. In this case, we use Fujifilm with zooming function for better characterization and detection. As a general rule, when we characterize the lesion, we depend on the color, the vessel, and surface pattern. When the color is the same or lighter than the background, or there is non-vessels or some scanty blood vessels, or there is surface pattern is dark or white spot or uniform size, we call these a type 1 or hyperplastic polyp. In type 2, the color is brown, more darker than the surrounding. There is a brown vessel surrounding white structure, and the surface pattern is oval, tubular, or branched white structure surrounded by brown blood vessels. So we call this adenoma. In type 3, which is a malignant lesion, we depend on the color is more darker than the background. There is disruption or missing of the blood vessel, and the surface pattern is bizarre shape, so we suspect this is a malignant. This is a nice classification that we depend on characterization of the lesion. The same characterization, we can use it by Fuji basic PLI adenoma serrated international classification. It already depends on also the surface, the beat pattern, and the vessels as the same as the nice classification. These are examples of hyperplastic lesion. As you see, the color is the same as the background in these polyps, and there is scanty blood vessels, and there is a regular surface pattern, so we call these lesions are hyperplastic polyp. In these examples, as you see, there is a brown color and there is blood vessels on the surface of it, so we say it is adenomatous polyp, and the artificial intelligence tell us it is adenomatous or neoplastic as there is a yellow indicator on the CAD eye or the artificial intelligence. Let's take examples of artificial intelligence detection and characterization. In this patient, the detector detects this very small lesion. We don't say it in the first. Then the indicator tells us there is a lesion. We come for this lesion. We use the LCI and PLI. And the artificial intelligence, as you say, more yellow is an plastic, or as you see, it is a adenomatous polyp. More green, it is hyperplastic. As you see, there is a brown blood vessels, and the color is more darker than the surrounding, so this is an adenomatous polyp. So we suspect this lesion is an adenomatous polyp. Another example of detection and characterization, as you see, there is a bar here in the upper corner with that highlighted by the yellow marker. This bar tells you about the zooming function, and we will see how we use it. As you see, there is a polyp. It is detected by the artificial intelligence, and there is another polyps here. We removed it. These bars, the green one tell you it is a hyperplastic, and the yellow one tell it is a neoplastic or adenomatous. As you see, he tell us now it is this lesion is an adenomatous polyp, and we make an zooming. As you see, the zooming tell us there is a brown color and there is scanty blood vessels, so he predicted it is an aplastic or adenomatous polyp. In this example, we can see a lesion or polyp behind the folds, and then we withdraw the endoscope and try to centralize the lesion in the middle and try to adjust the zooming function. In the first, he tells us it is an hyperplastic polyp, but after adjusting the zooming function, it changes the decision to neoplastic. If you are an expert, you can say it is a neoplastic from the first, as it is looks like an adenomatous polyp, but due to the movement of the patient, due to respiration, some artificial intelligence tell us some false, so it help us, but it not in 100% accurate. In this lesion, he tell sometimes it is a neoplastic and sometimes it is a hyperplastic, so you can't depend on it all time. In this example, we see these polyps. As you see, in the first, he tell us it is a hyperplastic polyp. I think it is false. The lesion have a blood vessels and it look like adenomatous polyp, not an hyperplastic polyp. But we try to remove any debris in the field and try to clear the lens to see it accurately. It look like an adenomatous polyp. We try the zooming effect. He changed the decision to neoplastic. There is another polyp below it that look like adenomatous also. As you see in the bar on the right, he tell us about the yellow area that he think it is a neoplastic. This lesion at the cecum, and there is a lot of debris. If you can't see well, you can flush water, as you see in a minute. We flush water to see the polyp underwater to make it better visualization of the lesion. As you see, the polyp looks adenomatous. Classic adenomatous polyp. We adjust the zooming function. He tell us it's hyperplastic. I think he is wrong. Some false result. He may tell us some false result. This lesion looks like also an adenomatous polyp. In the first, he tell us it is an hyperplastic. After zooming and try to centralize the region and try to adjust the focus and zooming function, in the last he tell us it is an neoplastic polyp. So yes, it is an adenomatous polyp, and we remove it by cold snare as it is small polyps. Underwater make better visualization of that lesion. In this example, we will see an hyperplastic polyp. He detects a polyp, as you see, making this green bar on it. Then we centralize the lesion and use the PLI. As you see, the color is the same as the background. There is scanty blood vessels and the surface area, giving the appearance of hyperplastic polyp. Yes, I agree with the artificial intelligence that this is an hyperplastic polyp, not an adenomatous polyp. As you see, the bar tells us it is a green, so he thinks it's a hyperplastic polyp, and we agree with him as it is hyperplastic polyp. Another example of hyperplastic polyp, as you see, some false result about the folds, but there is a polyp. We use the PLI and the zooming function to try to identify and characterize this polyp. Yes, it is an hyperplastic polyp. The color is the same as background. Scanty blood vessel, no blood vessels at all, as I see. We will make a zooming function, trying to identify more that lesion by zooming function. Yes, it is an hyperplastic polyp. There is another example of polyps when we draw the endoscope. We found this lesion. He detected it by artificial intelligence. Now we detect that lesion. We use the PLI mode to identify and characterize the lesion. Yes, it is hyperplastic polyp, scanty blood vessels. The color is the same as the background, so hyperplastic polyp is more with optical diagnosis. That is another example. We can see this polyp. As you see, by white light he detected it. Some false result from the false, but we use the PLI to identify and characterize that lesion. As you see, it is the color the same as background, scanty blood vessels on the surface, so it is hyperplastic polyp. We use a snare to make a cold snare polipectomy. As you see, we make a cold snare polipectomy and remove this polyp. Another example of polyp. We withdraw the endoscope. We found that lesion. We try to identify that lesion. As you see, this is the LCI. Then we turn on the PLI. He tells us it is an hyperplastic polyp, but I think he is wrong. This is an adenomatous polyp. He changes his position when we try to centralize the lesion and try to adjust the focus option. Until now, he still tells us it is an hyperplastic, but there is blood vessels and oval shapes on the surface pattern. It is darker than the surrounding. We try to adjust the zooming effect. He changes his position to neoplastic, then changes again. We try to adjust the focus. It is look an adenomatous polyp, classic adenomatous polyp. So he changes his position to neoplastic. When we go down, he changes also to hyperplastic. So I think the expert is more accurate than the artificial intelligence, but you need to adjust the photo and adjust the zooming effect and centralize the region. Still tell us this is an hyperplastic, but no, it is an adenomatous polyp. Another example of magnification. When we introduce the endoscope inside the ileum, as you see, this is a normal villi of the ileum. The artificial intelligence considers this villi as a polyps. So after a while, we turn it off the CAD eye, and the zooming function of the endoscope can tell us about that villi, it is normal or not. We also, with the zooming function, we can see the blood vessels inside the villi. The magnification function is very, very good. As you see, we increase the magnification to see the villi, as you see. When the bar turned to green, it is an computerized zooming. When it is in white, it is the regular zooming. We change the mode to PLI. As you see, the blood vessel is seen with the white light. Very nice photo. And when we see it with LCI and the PLI, we can see the blood vessels inside the villi. This is a normal villi, so this function is very, very good for detection any abnormalities in the terminal ileum. That is a function of zooming of the endoscope and is a regular view of the terminal ileum. In this case, we see to detection as a polyp, we can suction of all debris. We see this pedunculated polyp in the sigmoid column. We try to remove all debris and suction of all fluid from the colon, as you see. There is a polyp in the sigmoid colon, pedunculated. The artificial intelligence detects it. Then we use the PLI to characterize that lesion. In the first, he tells us it is an hyperplastic, but it's not a hyperplastic. Now he sees the adenomatous features, so he tells us it is a neoplastic. After controlling the zooming and the distance of the length of the lesion, so it is adenomatous polyp, as you see. Now we try to remove this polyp. First, we inject below the polyp. In the sigmoid colon, there is much of contraction. Now we inject below the polyp. We open the snare and try to catch the polyp with safety margin. As you see, we withdraw the snare till it hook the pedicle. We close it. Then we inflate the air again and try to go away from the wall. Now we catch the polyp and the pedicle with good safety margin. Then we apply the endocut current. As you see, we remove the polyp. It was removed. The pedicle was small, so no need for clipping or anything. That is the base, and we suck the polyp inside the channel of the endoscope. In this example, we will see a cold snaring of a polyp. This polyp looks adenomatous. He detects it. The PLI in the first tell also us it is an hyperplastic, but it's not an hyperplastic. It is clearly adenomatous polyp. We close the lesion. We made cold snare polypectomy for that polyp, and then we sucked the polyp inside the channel, and it got in the polyp trap to retrieval of this polyp. These are examples of the polyp trap that we have. This one we can change the this trap when the polyp get for this to change the according to the position of the lesion or the characterization of the lesion. This one also is a polyp trap. We can move this part to have a first specimen, second specimen, third specimen, or fourth specimen. Another example of polyp detection and characterization. There is a polyp. This lesion looks like adenomatous by white light. When we use the PLI, it tells us it is an anaplastic. We can use the zooming function. It is clearly an anaplastic polyp or adenomatous polyp. As you see the zooming function, we can see a blood vessel on the surface. In this area, it more looked like hyperplastic, but overall the lesion looks adenomatous. We inject below the lesion. Then we use a PLI again. It tells us it is an anaplastic adenomatous polyp. Then we will use a cold snare. Even after injection, we can use a cold snare. We use here a Boston snare that can we use for hot snare or cold snare for the same time. We have here a cold snare. As you see, this is the bed of the polyp, and we suction the polyp inside the channel and retrieve it. Another example of detection of polyps and characterization. These polyps looks like adenomatous by white light, but we can use the PLI also for detection on the characterization of that lesion. Here we detect it. We use the PLI. As you see, these lesions look like adenomatous polyp. In the first, he tells us in hyperplastic, then he tells us it is an anaplastic. The yellow bar is more than the green bar, so it is adenomatous polyp. And this area also, and this polyp is also a adenomatous polyp. The yellow bar is more than the green bar. After we have that optical diagnosis, we inject below these polyps to remove it. And also for the other polyp, with the same injection, we here in the sigmoid column, we inject the lesion, then we inject the proximal part as the distal part is more injected. So we inject the proximal part. We go just proximal to the lesion and inject to elevate it above the folds and above the muscle for good retrieval of that polyp after removal. Then we insert our snare. We get the lesion, the polyp with safety margin, and close it. Then we apply the EndoCAD current. And suction off the polyp inside the channel. And this is the base of the first polyp. After we suction the first polyp, we insert the snare again to retrieve the second polyp. We open the snare, get the polyp inside the snare. We get a safety margin from the normal mucosa. We close the snare. Then we inflate air again and get the lesion away from the wall. There is another polyp on the right, and the artificial intelligence detect it. And this is the base of the polyp. And we remove also this polyp with cold snare polypectomy. On conclusion, CAD Eye by Fujifilm, it is an AI-powered detection system, artificial intelligence detection system, integrated into Fujifilm Endoscope, real-time detection of colonic mucosal lesion, visual and auditory alert to guide the endoscopist. Benefit of AI detection: increased detection rate, more adenoma detection compared to traditional method, detection of flat and peripheral lesion, enhanced workflow in clinical practice, real-time assistant during procedure. But I think it is not all the time accurate, and all the time it gives you a good optical diagnosis. The expert can use without it, can make endoscopy without it. I think it is more helpful for younger doctor or for who is training to more detection and more optical diagnosis of the lesion. Thank you for watching. I hope this video was educational and to tell you about how to optical diagnosis and the CAD eye work. Any comment you can send for this email. Thank you for watching again, and see you in videos soon.